Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. This is Josh Sharfstein. Today, entrepreneurship and public health. I speak to Dr. Rebecca Gee, the former Commissioner of Health for the state of Louisiana, and now the founder of a startup company called Nest Health that provides home-based care to young families. You can see more about the company at nesthealth.com. Let's listen. Dr. Rebecca Gee, thanks so much for joining us on Public Health on Call. I want to introduce you to our podcast listeners as a public health official. Before we talk about your shift to entrepreneurship, you were the Secretary of Health for the state of Louisiana. What was that like?
It was fantastic, Josh. We were able to do a great deal of good in terms of expanding Medicaid, efforts to reduce or eliminate maternal mortality when possible. It was just fantastic. It was, of course, a political crucible, so that always made it fun, but it was a super job and a great opportunity to make some good changes.
I just recall when you were Health Secretary that people were very excited about what you were doing. Maternal mortality, equity, hepatitis C, other projects, thinking about things differently. And then when you stepped down, for a period of time, you went into academic institution.
It was I helped lead LSU through COVID, which was really important, was able to use those public health skills and disaster response skills that I'd honed as secretary. But some days it felt like watching paint dry. And so I started getting antsy and looking around for how I could make an impact and be a little bit more creative in the day-to-day world.
So tell us about the leap you made. Where did that start?
Really, it started in government. I was very frustrated by the lack of ingenuity from the private sector, particularly as it related to maternal and child health. Medicaid was started to improve the outcomes for moms and babies, and we really have been stagnant, if not worsening on those, particularly for women and children of color, and very, very marginal improvements in the delivery system. I had been able to, as a state, along with many people, transform how women experienced a hospital as it related to their deliveries, but not the before and after. We started looking around to see what kind of companies were out there. Maybe there's one I could serve on the board of. And I kept interviewing and never found it. And so I thought, well, heck, I'll start one myself. And fortunately, I had the good opportunity to meet with a venture fund, a venture capital fund. And the head of that fund, his name is Joe Lonsdale. After meeting him, I sent him 20 ideas of companies I thought someone should start, including what became the Nest. And he said, well, heck, let's fund this and get you started. And it's been a wonderful journey that started about a year ago.
So tell us about what the Nest is.
So the Nest reimagines the delivery system. And fundamental to the Nest is that instead of having everyone go to healthcare, we bring healthcare to individuals. But the other piece is that, and I'm a parent of 5 children. I have identical twin girls. I have an older set of twins. And it's been very challenging for me as a caregiver to deal with my own health, my husband's health, my kids' health. The pandemic really highlighted, I think, the plight of particularly women caregivers who are disproportionately burdened and blessed by childcare. And so really wanted to see what we could do to make their lives easier. So Nest is really focused around caregiving families with young children. And we bring healthcare to the home and also provide virtual supports. The model really has been birthed by a number of predecessors, including the NUCA health system in Alaska. It's a model that I learned about through Don Berwick, another one of my mentors. Looking at the experience of my friends who live in Europe, you live in Germany, or if you live in UK, home visiting is a part of the daily fabric for individuals who have a baby. In this country, we give you a baby and we just say good luck. And so I can tell you my experience was feeling isolated after having twins, not having the support. And so using that combination of how do we take primary care and how do we take home visiting, and let's create this model, and also understand that the whole family is a unit, right? So if we have a child with asthma, and we have a dad who's smoking, if we don't deal with dad smoking, we can't really treat the asthma in the child.
So for the families that would be part of this program, they wouldn't actually go to the doctor?
No, we come to them. We bring everything to that family, including specialists. We come and do the vaccines. We do blood draws, we do vital signs. We do all of the annual exams at home. And we bucket them into, you have a toddler and a baby and a mom. We'll do it all that same day. We know that in the first year of life, there are 7 well baby visits that occur. And so the opportunity for us to be in the home 7 times means that we can also see mom those times and check on her well-being.
So what's the process of starting a company like this like?
It's challenging. It's kind of like you're dropped in the jungle with no map, right? So you know where you want to be. In my case, I knew that I wanted to bring home visiting to Medicaid families. And NEST is really focused on Medicaid and the exchanges, the places where I think concierge care is needed most, but the environments in which it's least accessible. And people laughed at me. I was told there's no way you can do this company. Why don't you start? And you can't make money in Medicaid. There's no way you can make money in Medicaid. Why don't you just do a service where you go to the home for rich people and check to see that their outlets are covered with plastic? And I said, well, that's not what I want to spend this time doing. And let me just say one thing too, Josh. Why for-profit? Why private sector? I have watched year after year after year public health, great ideas, things like the Nurse Family Partnership, Parents as Teachers. They are Mother May I. Oh, please, can I get funded? Oh, I don't have enough resources. Okay, maybe I can do 100 of the 6,000 women in New Orleans, for example. So in America, we've decided that healthcare is a for-profit enterprise, for good or for ill. And the way that we scale in America is with making money. So that's why I went into this for-profit enterprise, is I want to scale this stuff. I don't want it to be beholden to the vicissitudes of public opinion and or political opinion. I think it needs to happen. And I think that the savings opportunities are tremendous as well. And I think it's a perfect marriage of a need, an area of Medicaid where there's very little innovation. There's a pitifully few companies trying to work in Medicaid, and exciting nature of value-based care, which allows a company like Nest to thrive. So it was figuring all of that out, but I knew what I wanted to do. And I had the blessing of having done things that seemed impossible before. And so that sort of was the Nest story early on.
If the Nest is successful, how will you know? What will you see?
In the city of New Orleans, for example, only 43% of our children get their well child visits. And only about 50% of women get their postpartum visits. So if the Nest is successful, we're going to have people getting their well care. We're going to have families thriving. We can improve health outcomes, reduce unintended pregnancy, hopefully can have a part in reducing child neglect or abuse, as well as abuse in families, because a lot of that comes from untreated mental health issues. We can have thriving, happy people who enjoy their health care and are achieving their own health goals. That's what we want. And we want ultimately to this lead children who thrive and families who thrive.
And the Nest is starting in New Orleans, is that right?
We're launching in New Orleans. We are the only company out there that is a value-based care company for the whole family, meaning that we are looking to improve. So one thing I didn't say is we'll take care of dad, of mom, of kids, the baby. That concept is novel, and there's going to have to be a lot of innovation around how we think about taking on risk at a whole family. But yeah, we're in Louisiana. And unfortunately, Louisiana is the 50th worst on maternal and child health outcomes. So it's a great place to be doing this work. And we're really excited. If you want to be in the Nest, you got to move to New Orleans, at least in 2023.
Is part of this idea that you will hire people from the communities that you are working in?
Absolutely, Josh. We call our family advocates, who are medical assistants, come from the community. All of our family advocates have been on Medicaid, understand what it's like to struggle in the early childhood years with taking care of yourself and your kids. We're really proud of that. The other thing we did is, before launching Nest, we went into 150 homes around New Orleans and we asked families what they needed, because we might think we have the solution, but we've got to involve the community in that solution. That's very much a public health. I was trained in community-based participatory research. So that's kind of how we approach this formation of Nest. But yeah, we're super proud. And our own Nest family advocates have had their struggles, have had near-death experiences as Black women, not being heard, not being seen, nearly dying. And they take that passion into the homes that we serve. And it's just incredible. And we're also really committed to a living wage, Josh. It's not shocking how many healthcare systems aren't paying a living wage. And a lot of our family advocates had to have 2 or 3 jobs, and we're paying over $20 an hour. And we're proud of that, and health insurance and decent vacation time, and also bringing the team to the table when we make decisions so that everyone, our frontline and our CEO and all of our workers are thinking together, because no one knows what it's like to go into the home better than one of our family advocates. So we're excited. I think that's so critically important. And as we grow, we hope to maintain that value set.
Let me ask you, when you're in government, you're raising money for things. You're going to the General Assembly, you're asking for the state legislature, you're asking for funds for different projects, you're trying to find funds in different parts of your budget. I imagine in this job, you got to be raising money too. How is that process similar or different between the public and private sector?
Well, in the public sector, I was kind of the political whipping boy for the Republican Party. And so it didn't matter even if they wanted to fund the thing I was asking for. We had to go through a kabuki dance of public whipping prior to the funding of it. So that doesn't happen in the private sector. But what happens in the private sector is it's also hard to get it's actually easier in government, right? Because if something's been funded in the past, it's a little bit easier to get a line item to fund it in the future. And I'd always have the Republicans especially would come every year and say, you're spending too much money. Oh, you're wasteful spending. And I'd say, great. Here's a list of all the programs that are optional for the state to pay for. That's a list of 20. Here, take them all, look at it. You tell me which to cut. You want to get rid of the nursing homes? Should we cut disability services? Here's a list. You tell me. And it was this political exercise, and they'd never pick anything. And then they'd still blame me for it. It was great. But anyway, so in the private sector, it's hard. We started Nest 2 years ago. It was a feeding frenzy for CEOs in the private sector. There was so much money. The markets were doing well, right? And right after starting Nest, the markets have gotten much worse, and the amount of capital has gotten worse. The Bitcoin and crypto has gone down. So it was a hard time to raise money. So I probably had to meet with 30 to 40 different venture funds. The other thing that I experienced, and this is where, unfortunately, there's gender bias everywhere, but I'm obviously a woman. I started Nest to be a primary care company, and everyone kept saying, you have a pregnancy company. And I kept saying, no, it's not a pregnancy company. It's a primary care company. And then I'd have 2 meetings with people, and they'd still say, oh, that pregnancy idea, what a great idea. And it was like, no. But a lot of the entrepreneurs out there who are women are starting pregnancy things. So that was a little challenging. All that to say, I really believe that a great idea, which I think Nest is, and a great team, ultimately prevails. And we have done very, very well. It's hard work. In the private sector, the other thing that you have to do is you have to show a lot. It's kind of similar to getting a grant, though, right? If you're getting funded by the NIH, you have to have done the work. You have to have your background and your talent and your bio sketches. In the private sector, you do that too. You've got the stories, you've got the demonstrable achievements of your founding team, you've got your metrics, and all of that you have to have ready to get funded.
What strikes me is how, in a way, you're really willing to risk failure. You were willing to risk failure in the public sector too. I mean, you tried things that absolutely could have failed. Here, you're raising money. You're telling people that you hope that you'll give them a return on their investment, but you don't know. What about that risk-taking appeals to you?
Oh man, I had a nightmare a couple of weeks ago before I got the funding that someone called me and said, the only option for funding for you is Donald Trump. You're going to have to take his money. And I was like, I can't do it. I can't do it. The people that I'm serving, it just doesn't make sense. So anyway, yeah, you have to risk failure. Look, I think failure, when I started off with the Hep C stuff, it was me and my chief of staff because people weren't taking it seriously, even in the department that I was secretary of. And so we spent 1.5 years working on it on our own. With Nest, yeah, it could fail. And the difference in the private sector a little bit is when you fail, now I have employees and their families and their health insurance, and I'm responsible for that. And if I don't raise money, they lose their jobs. And that's a new pressure. But yeah, that's the thing, is that you have to be willing to fail, particularly if you're trying to do something new. I actually listened to a fabulous interview last night by Michael Caine, who was being interviewed. And he said, use the difficulty is his message of life. And that's what I've had to do, Josh. Use the difficulty. He talks about he got taught as an actor that when something happens on stage and it's not quite right, use it to your advantage. If a chair is stuck in the door, fall over it if it's a comedy, break it if it's a drama. And I've had to use the difficulty in my own life. I've lost my mother when I was young. I had my first husband was killed and I was injured and in a wheelchair. And I have used that difficulty to be resilient and to be fearless. So now it doesn't mean my stomach drops to the floor on occasion. It does. But I believe that and understand from having lost my 31-year-old husband that life is precious. And I don't want to be doing stuff on the margins. I've had this opportunity to have this vantage point in government, and I've seen what's broken and I've seen the inequities, and I know what to do to fix some of this stuff, and I want to fix it. And if I fail, then at least someone tried. And then the failure will teach us what needs to be done next.
Well, it's just a remarkable set of projects and programs you've worked on now across the public sector and the private sector. Any final words for people who are really motivated to improve the world around them and are thinking of different options, the nonprofit option that you talked about, the for-profit option, the public sector? How would you advise them to think about that?
Well, look, there's more need in the for-profit sector. I said, fortunately or unfortunately, the enterprise that is Medicaid, which is where public health really is the heart of public health, populations need populations who are lower income. There's just a need for people, A, to go into government and work in Medicaid, who are creative and passionate. And B, there's a need for people who care about vulnerable populations and issues of public health to go into private sector to solve big problems. And it sounds daunting. We don't teach you. I mean, as a professor of public health, I'll tell you, I didn't get taught, nor do we teach you well. But there are lots of opportunities to join innovative teams and think about it. So be open-minded. Don't think, oh, this is for profit, and so these are the bad guys. Look, I mean, again, someone's getting, in my case in Louisiana, $11 billion a year to run Medicaid, and we better do a good job at it. So if you see something that's not working, think about other things you could do. For me, it's certainly never something I wanted to do. This was not entrepreneur in the private sector was not on my list, but it's a heck of a lot of fun. And I've enjoyed it. And I get to work. The other thing that's really nice is in government sometimes, at least in Louisiana, I had people working with me that didn't fundamentally believe in Medicaid, right? You have people that have careers and there's a new political regime, and you might be, in our case, we were a Democrat administration, and people said, gee, I don't want to make that happen. And people would actively blockade things we were trying to do. The nice thing about being in the private sector is everyone's incented, right? We all own Nest as an early founding team. Everyone has shares, and everyone wants it to succeed, because if it wins, we all win. And so Nest has been fun to see how you can get really talented people. I wake up every day pinching myself that people that had these extraordinary big roles would leave them to come work on this idea. It's taken a year. It's a little scary, but it's fun, and I would encourage it. I know, Josh, you're also innovative and entrepreneurial. And so thank you so much for having me today. And I would also, if people want to reach out to me, they're welcome to.
Great. Well, Dr. Gee, thank you so much for joining us on Public Health on Call.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.